Lucille Constance Gunning, Jamaican pediatrician, born 1922, couldn't find any sources on whether she's alive or dead. Lucille Constance Gunning has made important advances in rehabilitating children with disabilities. Her work has included studies in the care of handicapped children and the establishment of vitally needed extended care facilities for children with chronic health problems. The elder of two children, Gunning was born on February 21st, 1922 in New York City. Her parents, who were from Jamaica, were Susan and Roland Gunning. Because of poor health, Gunning was sent back to Jamaica shortly after her first birthday to live with her paternal grandmother. One formative event in her decision to become a doctor occurred at the age of 5, when she visited an aunt who was a midwife. Her aunt was helping with a delivery, the birth went badly, and a doctor was called in to help. He came too late, though, and the baby died. Gunning remembered, years later, their faith in the doctor. Everyone in the house believed unquestionably that the baby would have lived if the doctor had been there. She, too, would become a baby doctor. Gunning graduated from high school in Jamaica. She wanted to go to college in England, but World War II prevented this. She returned to the United States and entered New York University. She received her bachelor's degree in 1945 and promptly went to medical school at the Women's Medical College in Pennsylvania. She received her medical degree in 1949. In 1950, she served her internship at the Harlem Hospital Center in New York City. After a residency in infectious diseases in Detroit, she returned to Harlem Hospital Center, where she was chief resident in pediatrics from 1951 to 1952. She then became the chief of pediatric resident at the Women's Medical College of Pennsylvania Hospital from 1952 to 1953. In 1953, she married Carlton E. Blackwood, a fellow Jamaican and a chemist. After 1953, Gunning focused her interest on the long-term illnesses of children, especially on rehabilitating children with disabilities. In 1964, she began work at Montefiore Hospital, and by 1966, she had established a division of pediatric rehabilitation there and became its head. In 1971, she moved to the Harlem Hospital Center, where she became the chief of pediatric rehabilitation. At Harlem Hospital Center, Gunning created a developmental center for children with Down syndrome. She was careful to involve the parents of the children in the activities of the center because she recognized that they were the most important caregivers in the children's lives and that they also needed support. In addition, Gunning observed that the parents were some of her best sources for information about what treatments worked for children. Gunning became one of the founding members of the Susan Smith McKinney Stewart Medical Society of New York City, a group of black women physicians who mentor minority female medical school students. In 1981, she moved to Dayton, Ohio, where for 2 years she was director of physical medicine and rehabilitation in the Children's Medical Center. While in Dayton, she served as an associate clinical professor of rehabilitative medicine at the medical school of Wright State University. Beginning in 1983, she worked for the state of New York as the Deputy Director of Medical Services for the Office of Mental Retardation and Developmental Disabilities. In 1983, Gunning received the Physicians' Recognition Award from the American Medical Association in 1985. In 1985, she received the Charles Drew Pre-Medical Society of Columbia University Honorary Award. In the early 1990s, Gunning took a position supervising health physicians for school districts in Manhattan. She also has a private consulting practice. Her husband, Carlton E. Blackwood, died in 1974. They have 4 children, Elaine, Alexander, Lydia, and Anne. Citations are in the description.